Hello, Assalamu alaikum. My name is Dr Danya Bushwereb. I'm a family doctor GP from UK, and today I'm going to present neck pain. It has a scientific name. It's called cervical degenerative disc disease. I'm not sure if you came across it or not. So basically, it just means like neck pain, and I'm going to discuss about it in a simple way. It shouldn't take more than 10 minutes, so please stay tuned with me. If you didn't come across my channel, the reason behind this is just to increase awareness about common conditions a family doctor will see in the UK on a daily basis. So if we're going to speak about neck pain, let's speak a little bit about the structure or anatomy of the back of the spine. So as you can see here, that's the spine. So the spine, it has like two components in the spine. So the first one is the small bones, which are called vertebra. So as you can see, this is the bone and this is the bone. Okay, and then between each bone and another, you have like a jelly disc. And the job or the function of this jelly disc is to give the flexibility of the spine, so somebody can like bend forward, they can bend on the sides. So all of this flexibility, it's because of this jelly small little disc. And then behind each small bone, you have, like as you can see here, this yellow small tube. So this is the nerves which comes out of the bones. This picture shows the nerves. So all of this, as you can see, all of this is the spine, and you have all of the small bones with the disc like between them, and then out of these small bones, you have all of the branches of the nerves which comes from the spine. The branches of the nerve goes through the forearm and then through the arm, and then also you have here in the back of the spine the nerves which comes out of the spine, and then all of the branches, and then they go into the lower limb, to the legs. And this picture shows, like in a simple way, when you have a healthy disc. So it looks like really good and lovely. And then when you have like a degenerative disc, which means like a wear and tear, like a disc where there's like wear and tear in it. And as you can see here, like the disc, it has slipped from its normal position, and it's touching the nerves, and the nerves here are inflamed and irritated. And this has a name for it. This condition is called slip disc. So what are the symptoms when somebody has a slip disc in the neck? So first of all, you will have like neck pain. The neck pain can come and go. Not necessarily somebody has like a neck pain which is constant. So that's the first one. After that, like if somebody suffers from this problem, they will say, well, I have stiffness. I can't really move my neck around like in different directions, to the left or to the right. Then they might develop like tingling and numbness of the hands, and then in later stages there will be like weakness of the hands, and the main symptom, they will suffer from poor grip of the hands. They will say, well, I cannot really like hold things. I feel like the cup of tea is I might have accents that the cup of tea has fallen from my hand. Then we're going to go to the causes. So just to assure you, if somebody has like a neck pain or back pain, 90 to 95% of the reason behind it is just like a spasm, a simple spasm of the muscle of the back or of the neck, or maybe a spasm of the nerve. So it's not necessarily it is a slip disc. But let's say like from 5 to 10%, it could be because of a slip disc. So what are the causes? Now we're going to speak about the causes of slip disc, or of what of the name, what we said like in the beginning of the video, cervical degenerative disc disease. And the reason why I said cervical, because this area in the spine is called cervical, from C1 to C8. Okay, so let's go back to the causes. The most famous cause is wear and tear of the spine itself, of the bones, and that's secondary because of age. That's natural process. It doesn't mean like if somebody, it doesn't mean it's something like abnormal. It means it's just like a natural process of aging. Let's go back to here. Let's go back to this picture. So as you can see, as I mentioned here, this is a healthy disc, but then here, this disc is not. There's features of wear and tear. So what are the features? That the bone itself, it becomes swollen, inflamed. The space between each bone and another, the space becomes smaller. So here you have a good space, but here the space is smaller. And even this disc itself, there's wear and tear. You can't see that much of the disc itself, and that will, as we mentioned earlier, the disc gives, because it's jelly, so it gives flexibility. So that's why with age, we lose the flexibility in our movements, and also we always feel like a bit stiff, especially in the morning. So that's the first cause. The second one is bad posture. So the weight of the head itself, it's from 5 to 7 kilos. The problem when we bend forward, when we're always looking at our phones, and I know it's difficult with all of the addictions like we have like now, with always checking our mobiles and always like working on laptop, especially if you work in an office, you always have to like work on the computer. That will increase the weight of your head, and that can put more pressure on your neck and the bones in the neck and the disc, and also on the nerves. A lack of exercise. So why exercise is really good? Because it can tone the muscle, it can strengthen the muscles of the back, and even it can strengthen the bones, because it can increase the blood supply to the bones, and that can even increase the density of the bones. The problem with lack of exercise, you have weaker muscles and then also weaker bones. Sedentary lifestyle. So the advice is not to sit more than 2 to 3 hours, like if you're working in an office or anything, or like if you're working as a doctor, like sitting all of the time in a GP practice. So I know it's difficult if you're doing a busy job, but just try every 2 to 3 hours, even like walk a little bit and try to look at your posture, make sure like everything is fine, because you don't want to end up like really damaging your neck on a long term. Weight gain, as you can see here in the picture, this man is in a good weight, but when he increased in weight, the posture and the spine itself, as you can see, it become like an S shape, and there's more pressure on the neck and even pressure on the lower back. If somebody has like, let's go to the picture, this one. So if somebody has a slip disc here in the neck, that can cause, as we said, cervical degenerative disc disease. If somebody has a slip disc here in the lower back, that can put pressure on the nerves of the lower back, and that can cause something called sciatic nerve. Okay, let's go back to the causes of a slip disc in the neck. Another thing, of course, if somebody doesn't have any training and they went to the gym without any training and suddenly they lift something heavy, again, that can cause a slip disc. It could be genetically. Some families, it runs on the family that the spine itself, the shape of the spine is not like that normal. Sometimes even having low vitamin D, because low vitamin D can make the bones much weaker, and that can also like cause that. And if somebody, of course, that's one of the common causes. If somebody has like a previous trauma, especially if they didn't have treatment, they didn't have physiotherapy, but even if they had physiotherapy, they always have a risk that they might end up having a slip disc even in the future. So that's why if somebody has any trauma, they really need to see a physiotherapist to make sure they get the maximum treatment to prevent having a slip disc in the future. So what are the preventive measures before we go to any treatment? Of course, exercise, having good posture, having a good pillow which supports your neck, checking the vitamin D level. If it's lower, then of course you need supplement. If somebody, for instance, if they have like a slip disc, what will your GP, your family doctor in the UK, what will they do? The first thing, they will offer you physiotherapy. They will say, well, I can maybe do a referral, or if you can even self-refer yourself to a physiotherapist. Over the NHS might take a little bit of time unless you want to go private. Of course, exercise, and usually the exercise will, your physiotherapist will usually give you some homework and exercise to do at home. What your family doctor, GP, what will they do? They will discuss with you about like painkillers. So they will tell you, well, there's generic painkillers to take. I've spoken before, explained about painkillers, a painkiller ladder, which the GPs like to use in a previous video, but I'm more than happy to explain it to you again. So painkiller ladder, it's like a ladder step. So the first step will be like just simple painkillers, no addiction to it, like paracetamol, ibuprofen. You can even buy it over the counter. The next one will be naproxen, something a bit stronger than paracetamol and ibuprofen. And then the step after that, of course, it will be a bit the stronger ones, which can cause addiction, which are called control drugs like tramadol, codeine, and then you have even stronger than those like morphine. Okay, so these are the generic one, and then you have like specific one for nerves like duloxetine, amitriptyline, gabapentin, pregabalin. Okay, so usually your GP will start with a small dose, discuss with you about the side effects of each one, and monitor and then see how things are. So slip disc of the neck usually takes sometimes it takes up to 3 months, and then it improves by itself. It improves even, as I said, like sometimes physiotherapy, a bit of painkillers. If it doesn't improve, what your doctor will do, they might refer you to nerve conduction studies, or even do some imaging to the neck, like an X-ray or like an MRI, just to check for any wear and tear, like as I said, like any osteoarthritis of the neck, or if they see like there's any pressure on the disc or on the nerves, all of that. You can see it through the MRI. If the symptoms get worse or it didn't improve in 3 months, or if there was any red flags, like for example, if somebody cannot feel the hands, they lost the sensation in the hands, that means that there's a lot of pressure on the nerves on the neck. So that really that may need a referral to a spinal surgeon. And to be honest, surgeons will not be interested in giving medications and stuff. They're only interested in surgery. So if your GP gonna refer you to the spine surgeon, so that's for discussion of the possibility, of a surgery. But again, that not necessarily that you need a surgery, but it will just be a discussion and assessment from a spinal doctor. And if you're going to go ahead with that, they would like to discuss about the side effects of a surgery. As you know, like e-surgery, they always have like side effects, especially if it was like in the spine. If there's any questions, please write them in the comments. Hopefully I explained it like in a simple way. I tried to make my videos less than 10 minutes. I went a bit above anyway, but it's just 11 minutes. Please let me know any questions. Thank you.